This was June 26, 1998, was the day that I was diagnosed. I was 3 weeks into the summer after my second grade school year. I started experiencing some severe abdominal pain, nausea, and really, really tired because I couldn't keep down any food or any other nutrients. And so my mom noticed that something wasn't right. This wasn't the regular old tummy virus that other kids in their neighborhood had. So she called my pediatrician and we got an appointment to come in. He started feeling around a little bit more, and I noticed that he started paying attention to one particular area. And then he started talking to my mother in a hushed tone and stated that we'll need to schedule an emergency CT scan and have the results read today. He talked to my mother outside of the room, and that's when I knew it was something that quite wasn't right. But I still overheard a little bit of him saying that there was a mass in the center of my abdomen and possibly cancer. Had no idea what that word meant, so I showed no emotion. I just knew it had to have been something bad if I didn't want me to hear. I knew what I had was pretty bad because all my visitors that came to see me when I was first diagnosed were tearful. No one could keep a dry eye. And so with my childlike mind, I tried to understand cancer cells like the alphabet. So whenever they told me B-cell lymphoma, I'm thinking, okay, well, B is closer to A. And so I'm trying to reasoning with my childlike mind that, well, B must be okay, like almost good, because it's closer to A. And so it took the doctors and the residents a while to be able to explain everything to me. For about 3 days, we went through a battery of different types of tests. And on the morning of the third day, I had emergency surgery to remove some of the tumors throughout my abdomen. And this was on my small intestine, my colon, and as well as my ovaries, and a couple of other areas, including my appendix. One protocol I was treated with was R-CHOP, also a clinical trial as well. And I distinctly remember one of the drugs being doxorubicin, and all us other kids in the hospital nicknamed that drug Red Devil because of what it did to us. Like, whenever we seen our friends in the hospital with that on their pole, we knew it was going to be a little while before we'd be able to play with them again, because it was definitely brutal, but it gave me a fighting chance. While I was in the hospital, I participated in the in-hospital school program here in Anderson. And I have to say that my teachers were phenomenal educators because they never let me give up. I distinctly remember there was one time one of my teachers came to my bedroom, and this was in a period of time where my outcome wasn't looking very good. And she helped me out of bed, and I got into my wheelchair, and she wheeled me down to the classroom so that I didn't fall behind in my education. And I think that was one of the pivotal moments during my time in treatment, is understanding that education is empowering. It gives us options and it gives us opportunities to do great things. And so the role of an educator should not be taken lightly. I am in graduate school at Texas Women's University. I'm pursuing a Master of Science in Health Studies, and my research focus is in cancer health disparities. During undergrad, I had the opportunity to lead several impactful health initiatives for tobacco prevention and women's health, as well as community health and social empowerment programs. I remember this quote: "The moral test of government is how that government treats its people, those that are in the dawn of life, the children, those that are in the twilight of life, the elderly, and the needy and the sick and the handicapped." And so I keep that in the back of my mind when I'm out in the communities, working with different people and organizing early detection screening programs. Cancer, I assumed it was a curse and a death sentence at first, but I really believe that it gave me a gift and the will to live a fulfilling life. What I would say to anyone that's facing adversity, whether it be disease or any other difficult circumstances, that it doesn't matter how much the disease or experience affects you physically. What really matters is how you triumph over it mentally and spiritually. I think my faith was my source of overcoming, and I believe I conquered cancer in my faith and in my spirit before I actually realized the physical manifestations of healing.